So welcome to one of the modules which I think is one of the most challenging. A trauma correction case, age 13, was discovered to have a parotid tumour on her left side, but unfortunately she had a full facial nerve palsy because it was transected. And essentially we're dealing with two faces, 0.5, 0.3, 0.3. But in total, with Botox, she needs to have 1, 2, 3, 4, 5, 6, 7, and then another one, 8. And within this 1 centimetre, pick the most depressed part, the superficial branch of the temporal artery, down all the way to the periosteum. Number 1, that you don't follow the artery, because that's going to be very dangerous. Onto the bone, in the opposite direction of the artery, but always medial to the buccal maxillary ligament. Staying nice and superficial here, injecting 3 units of Botox. Now time for the platysma. Always inject in the orientation of the fibre.